that's where people then also say that if they are aware of the person doing the self-injury because they brought it to their attention, they're showing you a scar, they're showing you where they've cut or whatever the case is, that somebody would then say, you're only showing this to me because you want some sympathy out of me. You want some attention. And what I hear you, and I'm connecting with what you're saying, is that is probably true in the sense that they want to be related to. They're not doing it out of a place of malice, or again, that manipulative space, but they're doing it because there is some part of them that's just saying, I need to be seen. And I say that quite a bit. And I when I tell people, like, I have to check myself too, because when you have been, again, going back through our childhood experiences, which is like the big overarching theme of One Broken Mom here, is that, the people listening have gone through some stuff, and you may be getting triggered. It may have nothing to do with this person asking for some witnessing or some acknowledgement and seeing them. What you may be responding to is somebody in your past who did try to manipulate you, or used you, especially in that capacity. And so that's, when I tell people, like, if you feel that trigger coming on, like, this person's totally manipulating me, I'm with you. I think the word is terrible. And I also think it's terrible when it's applied to the behaviors and actions of children, because it implies that they have a high level of, thinking and skill sets about it, but they don't. They're just trying to establish a connection with their parent, or their social circle and stuff like that. And so I'm glad you brought that up, because you're right. That's the downside to this, is to constantly be telling somebody or dismissing them, when they're doing this, thinking that they're just doing it to get you to give them sympathy. And I mean, at the end of the day, is that a terrible thing? If we need some support and some comfort, is it wrong for us to ask for that from people?
Exactly. And I think, again, I like to use the phrase, they're trying to get their needs met. And so, thinking about what need do they have right now, right? Do they need me to acknowledge their pain? Do they need me to acknowledge their distress? Do they need me to validate their experiences? And, as a parent myself, and I know this is fairly common among parents, we struggle with validation, right? We struggle with, so when a kid comes up and is really distressed about something that we think is fairly minor, our usual response, oh, get over it. Oh, that's not a big deal, right? That gives an invalidating message. And again, the majority of us do that, if not a little bit, a lot, right? And most kids who are not struggling with mental health concerns, who are not experiencing significant trauma or distress or disadvantage or adversity in their lives, they can handle that, right? But for the kids that can't, or the kids who are really experiencing a lot of this adversity, that invalidation, particularly when it's really, severe, or when it's, continuing, it basically tells them that what you are experiencing is not accurate, that your needs are not going to be met, and they're also not important needs. They're actually might not even be real. And so what does that do? That makes us increase. It makes us so, if this behavior didn't get me heard, what behavior is going to get me heard next? So if coming up and saying, I'm really upset right now, doesn't get me heard, then maybe self-injuring gets me heard. If self-injuring doesn't get me heard, then maybe I need to self-injure worse, or I need to get drunk, or I need to do something else that is taking it even higher, right? And this isn't a conscious process. It's not like people are sitting down and saying, what should I do next, right? It's happening at a level that is not always, presently aware for that individual. And so, as parents, as caregivers, as loved ones, we need to look for what are they trying to communicate to me? What is the need that they need or what is the thing that they need from me right now? And how can I give that to them in a way that is effective? And how can I help them to figure out a more effective way to get that from me?